it produces positives even when there's no virus there at all. We call that a false positive. As we've increased the number of tests done per day, so we've had to recruit less and less experienced laboratory staff, and now we're using people who've never worked professionally in this area. What that does is it increases the frequency of mistakes, and the effect of this is that the false positive rate rises and rises. So if you had a false positive rate of 1%, which Mr. Matt Hancock told us was roughly the number they had in the summer, then if you tested 1,000 people that had no virus, 10 of them would be positive, astonishingly. If the prevalence of the virus was only 1 in 1,000, that's 0.1%, as the Office of National Statistics told us it was through the summer, then if you use the PCR test, only 1 of them will be positive, and genuinely so. But if the false positive rate is as low as 1%, you'll also get 10 positives that are false. Some people did say to me, well, there'll be a higher percentage of people coming forward for testing in the community, so-called pillar 2 testing, because they've been instructed only to come if they've got symptoms. But I call BS on that one. I don't think that's true. I know lots of friends and relatives who've been told by an employer, well, you've sat near someone who's tested positive and I don't want you to come back to work until you've got a negative test. I've seen information from many towns in the north, certainly Birmingham was one, Manchester was another, Bolton, where councils, and I really think they were trying to be helpful, were out leafleting the people of their cities saying, we're going to come round and swab you all because we want to track down this virus. Now, once you start testing people more or less randomly, instead of having symptoms, you get the same amount of virus in the population as the Office of National Statistics found, which is at the time was 1 in 1,000. And I've just told you, Matt Hancock confirmed during the summer, they had a false positive rate of about 1%. So that means out of 1,000 people, 10 would test positive and it would be a false result, and only 1 would test positive and it was correct. This test is monstrously unsuitable for detecting who has live virus in their airway. It's subject to multiple distortions that are worsening as we get into the winter. As the number of tests done per day increase, the number of errors made by these overworked, not very experienced lab staff increase. I think it's not unreasonable to say a best guess of the false positive rate at the moment, what's called the operational false positive rate, is about 5%. 5% of 300,000 is 15,000 positives. I think some of those positives are real. I don't think it's very many. Now, the problem with this false positive issue, it doesn't just stop at, quotes, cases. It extends to people who are unwell and go to hospital. So people who go to hospital having tested positive, and it could be a false positive, and I think most of them are at the moment, if you go to hospital and you've tested positive previously, or you test positive in hospital, you'll be counted now as a COVID admission. Although there are more people in hospital now than a month ago, this is normal for autumn. Regrettably, people catch respiratory viruses and become ill, and some will die. I just don't believe it's got anything to do with COVID-19 anymore. There are more people in intensive care beds now than they were a month or so ago. That's entirely normal. As we move through late autumn and into the early winter, those beds become used. But there aren't more people than is normal for the time of year, and we're not about to run out of capacity, certainly at a national level. But I think you know where this is going now. If you should now die, you'll be counted as a COVID death. But that's not correct. These are people who might have gone to hospital having had a broken leg, for example, but 3% of them will still test positive, and they haven't got the virus. It's a false positive. And if they die, they'll be called a COVID death, and they are not. They've died of something else. One of the most troubling things I've heard this year was Mr. Johnson telling us about the moonshot. Testing everybody often, maybe every day, is the way out of this problem. But I'm telling you, it's the way to keep us in this problem. That number of tests is orders of magnitude higher than we're already testing now. And the false positive rate, however low it is, will be far too large to accept. It will produce an enormous number of false positives. What we should do is stop mass testing. Not only is it an affront to your liberty, it will not help at all, it will be immensely expensive, and it will be a pathology all of its own. We'll be fighting off stupid people, mostly government ministers, I'm sorry to say, who are not numerate and do not understand statistics. If you test 1 million people a day with a test that produces 1% false positives, 10,000 people a day will wrongly be told they've got the virus. If the prevalence of the virus was, say, 0.1%, like the Office of National Statistics said it was in summer, then only a tenth of that number, 1,000, would correctly be identified. But you can't distinguish amongst the 11,000 who have genuinely got the virus and who are false positives. Moonshot, I think, will have a worse false positive rate. It's not fixable, and it's not necessary either. The pandemic, having passed through the population, not only of the UK, but of all of Europe and probably all of the world quite soon, it won't return. Why won't